So you start with arteries, and this next word, arterioles, that's small, I call them baby arteries, okay? Arteries are larger, and then arterioles will be smaller, okay? Then capillaries, that is the happening place, okay? That is where the gas exchange occurs. The O2 is dropped off right here, and then you're going to scarf up, and any carbon dioxide as metabolic waste, you're going to grab, okay? And then it goes to venules. You can think of venules as small baby veins, and then all the way back to the heart, okay? All of the heart and blood vessels we're going to consider our cardiovascular system, okay? There's kind of, I don't really know why they use the term circuit, unless it's to kind of demonstrate a route that your blood is going to take. So you can kind of think of it in those terms. Now, what actually makes blood move through our lazy river? It's the pumping, it's the contraction of the muscle. The heart is a muscle, and so when it contracts, that's going to move the blood flow, okay? Anytime you see pulmonary, pulmono, anything like that, that means lungs, okay? So the pulmonary circuit is actually going to be blood that is oxygen poor. Oxygen poor. What color would that be, red or blue? It's going to be blue, okay? And that blood goes from the heart, boom, to the lungs. What is it getting at the lungs? O2, and it is fat and happy, okay? It is full of bubbles, all right, and ready to deliver. So it actually goes from the heart to the lungs and then back to the heart, okay? So blood is going to pick up O2 from the pulmonary capillaries, and it's going to drop off carbon dioxide to the lungs. So then what are you going to do? How are you going to get rid of that carbon dioxide? You're going to exhale, get rid of that carbon dioxide. Okay, so that makes sense. That's one kind of route. The other route is, okay, now we've got oxygen-rich blood, and we have to deliver it to every single body cell, okay? Everybody has to have oxygen to stay alive. Every body part has to have oxygen to stay alive. So the systemic circuit is who delivers that oxygen, okay? Good. When you are looking at this, when you are looking at the models, or if you're looking at a diagram, it's going to be like you're facing it. So this is the right side, this is the left side. Now, you'll be looking at it this way. So when you are pointing, the right's going to be diagonal, okay? What you can recognize is this whole right side. What is the predominant color, red or blue?
Blue.
It is blue. So it has not been to the lungs yet. As soon as it goes to the lungs and picks up oxygen, woohoo, we are happy and we are red, okay? That's actually the way it works. So the left side, oxygen rich, gonna be red, and the right side, did I say right side or left side?
You said right.
The left side is going to be oxygen rich, and the right side is going to be oxygen poor, okay? So let's look at some terminology. I think that, especially since it's close to Valentine's Day, everybody knows that this is the real shape of your heart, right? No. Your heart is about the size of your fist. Hey guys, did you do your bonus? Livy, did I ask you, did you do your bonus?
No, ma'am.
Anybody else sneak in? Okay, so, wow, that's a bumpy heart. I got crazy. So, your heart has 4 chambers. Now, what chambers actually are is a space. It's really a space that your blood is going to be able to flow through. Okay, so we're going to call the upper chambers atrium. You have a right atrium and a left atrium. But you see this word, right? That's plural. So if you're talking about both of them, you would correctly say atria. Or if you're just referring to one, it will be atrium. Recognize that it's really the same word. It's just a different tense as far as singular and plural, okay? And then you have 2 ventricles. They're lower chambers. You have a right ventricle and a left ventricle. If I am asking you, Lane, was there a, no, if I'm asking you on the lab exam, a chamber, a heart chamber, I will use the word chamber, okay? Because remember, it's a space, so how am I gonna tag it, you know? This list has, if it is not on this paper, you will not be asked it in on the lab exam. Remember, lab exams for 202, piece of cake. Nothing like bones, bone markings, muscles, organs, insertions. It's really not. So even though you say that the lab exam is going to be soon, you've got time. And if you don't, if I say that we're not ready, then, you know, we move it, okay? So this is the way it's going to look. The lower chambers, the ventricles, are the pumping action, okay? That's why the ventricle muscle walls are much thicker. What happens when you work muscles? Don't ask me because I don't have any. I'm allergic to exercise, okay? So I don't have any muscles. I just got flabby, okay? But what happens when you go to the gym, guys? It's going to enlarge, it's going to get bigger. So your ventricles, the wall is actually much thicker than the atrial walls. They contract, but it's kind of a whoosh. They're wimpy, okay? Good. Like I said, your heart is about the size of your fist. Now, I just think that I'm so sweet that mine has to be bigger than this. Don't you think? I think mine should be about the, you know, I don't know. But anyway, you're going to see Thursday, hopefully, you're going to see Thursday that we've got cadaver hearts. And this morning I said, we've got real live hearts. It's like, well, no, we don't. They're dead. But anyway, so we're going to see real hearts, but they're real cadaver hearts. And one, I kid you not, y'all, I'll never forget when I first saw it. It is this big. It is huge. Now, this person that had that very large heart actually died from congestive heart failure. His heart was enlarged because it had to work so hard to get the blood flowing throughout its body. You'll be very impressed, okay? So your heart is going to fit inside your thoracic cavity. So listen to this and visualize, please. So it's posterior to the sternum. Yep, I don't see my heart sticking out up here. Okay, so it's behind, posterior to the sternum. Okay, my lungs are here. So your heart is medial to your lungs, anterior to the vertebral column. Yep, my heart's not sticking out back there. And then the base is at about the second rib, and the apex is about the fifth intercostal. So let's look at that in the thoracic cavity. So I want you to note that that's the apex. So the apex is actually inferior. Right here, apex of the heart. I always ask that one, nobody ever misses it, okay? So apex of the heart is just right there. So that means that this area is the base, okay? You kind of like to think, well, okay, the apex is the top and the base is the bottom, but that's not the case in our heart, okay? So that's why I'm making such a big deal out of it. This is the base up here, and then this is the apex, okay? Good. This is 201, so you better impress me, okay? We had two types of serous membranes. Two types of serous membranes. Who remembers which term applies to the closest to an organ? Visceral. Visceral is going to be the innermost layer, and it actually touches organs. So let's build a word for the name of this membrane that is going to be on top of the heart, and we're going to use this word, pericardium. Para means around, cardi is heart, okay? So visceral pericardium is actually going to line the heart. So this is actually a great blow up. So if this is the myocardium, this would be the visceral, and then this layer, you know, it's a double layer. That layer would be the parietal peritoneum. Oh, excuse me, that's around your kidneys. I totally misspoke. Parietal pericardium, okay? And then you can see that this in between there is your pericardial cavity. A couple of slides ago, I said that your heart was in your thoracic cavity. Everybody remember? That's true. But if you're just talking about the heart, so here the whole thoracic cavity would be like that whole thing. So yes, your heart is right in there, and it's in the thoracic cavity. But if you want to narrow it down further, it's also in the pericardial cavity. Makes sense? Okay, good. These are terms that you need to know. They're terms that will be used in the questions that I ask you. And so you need to understand what they are, where they are, so that you can answer questions correctly. There is an additional very thick, fibrous outer covering, and you'll see it when we do the dissections. I can't remember whose heart we dissect, if it's sheep or cow. I think it's a sheep. Sorry, I couldn't resist. I'm so juvenile. That just snuck out. So this extra outer layer we're going to call fibrous pericardium. Okay, it's actually in addition to our 2 layers of serous membrane. One thing I want you to note, down here, you see this term epicardium. In some textbooks, some instances, this term will be used. EPI means literally upon, okay? So epicardium would be the same thing as visceral pericardium, okay? They are synonyms, they're the same thing. Most often I always use visceral pericardium, okay? Super. So how about if we are going to look at the walls of the heart proper? So here we have this term again, epicardium. That's going to be the visceral pericardium. The middle layer, myocardium. What does MY with a combining vowel O mean? Muscle. Okay, so that's telling you right there, myocardium is the thickest and it's the muscular layer of the heart. Okay, it looks like a really nice piece of salmon to me. So, I know I'm weird. And then you're going to have the innermost layer, and of course we're going to call that endo, inside, within, endocardium. Okay, and that would be this layer right here. And that layer actually forms the heart valves as well, okay? So if you don't like pictures, you now have a boring table. If that works for you, there you go. Doesn't do a lot for me. It's not even in color, okay? So let's take a look. Okay, I'll just do this. It'll go away then. All right. So we're going to look again at our heart chambers, and we're going to add a word. Let me go back. Let me go forward. Okay, so this area right here, and we're going to go down to the lab, and you're going to have a heart, and you're going to talk to it and fondle it and poke it and do all kinds of stuff. So this is the right atrium. This would be the left atrium, just this top part here. Notice that this has little flappy looking things. The ventricle doesn't have that. So this, let's see what a flap-like projection sounds better than flappy looking things. So these areas on both on the atria, we're going to call auricles, right and left auricle. So right here is kind of a leafy little thing. This is the word I'm saying. Right and left auricle. Okay, it's just right at the tip of the atrium, and it actually allows for a little bit of expansion. Okay, so you're going to see this coming up in just a minute. We're going to work on an exercise that y'all will love. So 4 heart chambers and 4 heart valves, okay? 4 heart chambers, 4 heart valves. So this I used to do as a short answer. So this is, I think, number 4 on your study guide. And you are going to know this. There are two categories of heart valves. The AV valves, and the AV actually stands for atrioventricular valves, okay? The 2 AV valves are the tricuspid valve and the bicuspid valve, okay? So we're talking right here. That's the tricuspid. This one is the bicuspid. The bicuspid valve is also known as the mitral valve. Both are correct, and you may use either one, okay? So the tricuspid valve connects the right atrium and the right ventricle. The bicuspid or mitral valve connects the left atrium with the left ventricle, okay? Now, these 2 valves, the AV valves, have 2 very special structures, okay? And the way that it works, so Cease, that's my man, was a year ahead of me in dental school. So he graduated in 1980. I know y'all were so old. He graduated in 1980, and so when I was a senior in dental school, he had already moved to Fort Bragg, Fayetteville, North Carolina. He was on an ROTC scholarship for undergrad from the University of Alabama. So he actually went into the 82nd Airborne Division. They have those cool red berets, and oh man, was he ever a hottie, okay? Here's the problem. Anybody know what the 82nd Airborne does? They're paratroopers. They jump out of perfectly good airplanes. Hello. I thought I was married to my smart, okay? So, this actually represents Cease. This little circular thing. And now look, do you see that big fat smile? That's because he's thinking about me floating all the way down, okay? Of course. So, the actual parachute, they used to be round and army green. Okay, now they're pretty and kind of rectangular and everything. But when I used to see him jump, it was it was round and army green. Okay, so the parachute actually represents the valve. It represents the tricuspid and bicuspid valves. Okay? Now, to keep him smiling, he actually, like a backpack, attached a vest and a backpack, he actually has the parachute packed in a backpack on his back. This is important. And so we've got to have somehow to attach this little floaty thing, the valve, to the backpack. And that's what these little strings are, okay? There'll be strings attached to the parachute and attached to the backpack. So what that represents is this little plastic thing right here, the white, that's the valve. And then see these little strings? Right here, you can see them. these little strings, they are called chordae tendineae. Chordae tendineae are the very fibrotic strings of connective tissue that connect the backpack to the parachute, to the actual parachute top. Now, you say to yourself, well, who is C's? What does he represent other than the happiest man on earth? He represents the papillary muscle. So look right here. Here, do you see how those strings are attached to the papillary muscle? So what happens is when the blood flows from the atria into the ventricles, that valve is open, right? Because if it's closed, it wouldn't flow. So when the ventricle fills up with blood and enough pressure is accumulated, then the myocardium, the muscle, will contract, okay? Prior to that, the papillary muscle will contract. And when it contracts, it pulls those strings very tight. And what do you think happens to that valve? It closes. It closes, and it closes very tightly because nobody likes Mountain Dew backwash. Who wants the last swallow of your friend's drink? Nobody. It's filled with, let's see, can we say saliva instead of spit? I mean, you know. All right, so we don't want blood to go from our right ventricle back up to the right atrium. This is a one-way street, folks, okay? So that valve is going to be closed, all right? Now, here's the cool thing. We have two other valves, and they're going to be classified, and you need to know these classifications. You need to know that the AV valves are tricuspid and bicuspid or mitral, and that they have these special structures. And you also need to know that the semilunar valves are the pulmonary valve and the aortic valve. They do not have chordae tendineae. Now that's a test question. Semilunar valves do not have chordae tendineae and the papillary muscle attached. Only AV valves. Clear? Okay. They're even shaped very differently. Look at these, and then here's the pulmonary valve, semilunar, and then you can't, it's hard to see. Right here is the aortic valve, okay? Those are classified as semilunar. The pulmonary valve goes from the right ventricle to the lungs. I ran out of space. That squishy word says lungs, okay? So right ventricle to the lungs, and the aorta. Ashley, I wish you could see your face. You're squinting like, I don't believe you. That doesn't say lungs. Well, it's supposed to say lungs. And the aortic valve is going to go from the left ventricle through the aortic valve, through the aorta. Okay? Good. So you need to know this. You're not going to have to draw the picture of C's, but if you do, put a big old smile on his face. Okay? So now we are here. Ashlyn, did you do your bonus? Okay. So get your bonus out, and if you don't have your bonus, did Shelby ever? Shelby never came in. Ashlyn, where are you? Okay. So if you don't have your bonus, then look behind me here. I'm going to drive you crazy over the next 15 minutes, more than usual. So get ready, be patient. You're going to repeat after me. We're going to learn the path of blood wave through the heart. We're going to pretend that we're one little drop of blood, okay? Now, in reality, you're gonna have, when you have blood filling in your right atrium, you have blood in your left atrium. You're gonna see that they work in a coordinated, it's called, we'll get to this, it's called a syncytium, and they work together. When the atria are contracting, the ventricles are relaxed, and when the ventricles are contracting, it's coming up, we'll do a whole thing on it. When the ventricles are contracting, then the atria are relaxing. So they work in coordination, okay? Your heart is an amazing thing. That's why I'm thinking it's gotta be bigger than this, okay? So, remember that you're going to say here, you're going to say superior, up here, vena cava, and inferior vena cava. Now, can everybody see that that sort of is vein? Vena is a huge vein, okay? Vena cava is the largest vein in your body. So this is what we're going to do. You're going to repeat, let me see if anybody's out here. Is there a class somewhere? I'm so loud, I don't care. Oh yeah, good, he closed his door, I can close it on. So get ready. This is how we're doing it. I love you, Lane. 3 structures bring unoxygenated blood into the right atrium. Superior vena cava, go.
Superior vena cava.
Y'all gotta pick up the pace. We're gonna be here up so okay. Superior vena cava, inferior vena cava, and then the coronary sinus. Again, I'll show you that in a minute. Okay, 3 structures bring unoxygenated blood into the right atrium. Go. Superior vena cava, inferior vena cava, coronary sinus. Okay, now let's find them. So, give me, oh, whoops. Okay, superior vena cava, inferior vena cava. Now, when you see your heart downstairs, you're going to open the right atrium, and in the bottom of it is actually the coronary sinus. I am not asking you the coronary sinus there. It's too hard for me to tag. I'm going to ask it, do you see this little blebby, bulgy looking thing? That's where I'm asking you. Okay, so superior vena cava, inferior vena cava, coronary sinus. Let's do that again. Superior vena cava, inferior vena cava, coronary sinus, into the what? Right atrium. Excellent. All right. So after the right atrium, we go through the tricuspid valve to the right ventricle. Okay, start with right atrium. Go.
Right atrium, tricuspid valve, right ventricle.
Wow, that was pretty bad. Okay. I know, I was not clear with my directions. So now I'll be very clear with the directions. We're starting with the 3 and we're going to the right ventricle. Go with me, please. 3 structures bring unoxygenated blood into the right atrium. Go.
Superior cava, inferior vena cava,
coronary sinus, into the,
right atrium,
through the,
tricuspid valve,
to the,
right ventricle.
Staking. That was good. That was real good. Y'all made me happy. Now I got to drink some water. Thought I was going to drink something else, didn't you? Too early for final round. Okay. You are going to say that over and over and over. You're going to write it over and over and over. You're going to get your heart and you're going to touch it and say superior vena cava. Promise. You've got to do it this way. Well, you don't have to. You can flunk. But if you'll do this three learning styles, you're tapping into all three of them. Okay, so now we're going to go from the right ventricle. Now, we're a drop of blood. When we went from the right atrium to the right ventricle, can you appreciate that as long as that valve is open, a lot of it's just going to, because of gravity, go down there. Okay, so when the atria contract, it's like, whoosh. Huh? That was a weenie. I mean, it's whoosh. Get on out of here, blood. Go on down, okay? Now, when the ventricles contract, honey, you got to go up and over. So when the ventricles contract, it's whoosh. Okay? And that's why when you look, their walls, ventricular walls, are much thicker, because when they contract, they're going to get your attention, because it's got to go from right ventricle, pulmonary valve, pulmonary trunk. Oftentimes, really large arteries, they may substitute the word artery for trunk. So you would never be wrong by saying pulmonary artery, okay? But this one we usually say pulmonary trunk, and then it's gonna split, and when it branches, we change names, okay? So pulmonary artery, right and left pulmonary artery, okay? And then we're gonna go to, where did my guy go? Here we go. So right there, that's a pulmonary artery right there, pulmonary artery. What color is it?
Blue.
Blue. Hadn't gotten oxygen yet. Then it's going to go to the pulmonary capillaries. You can put pulmonary capillaries, or you can put lungs. Either one of them, you know you're getting oxygen, okay? And then look what happens. Woo! We get bubbles. Yeah, bubbles are great. Whoa! We got double bubbles. We got so excited getting that oxygen so we can get it to my pinky toe. We got it double. There are 4 vessels that bring oxygenated blood into the left atrium. Now, I think that's exciting. I mean, why do you think I drink bubble water, you know? It's got bubbles in it, oxygen. I like to think I was champagne. Just kidding. No, oxygen. So, here we go. We're starting here. Okay? Right ventricle. Good, Emily. Pulmonary valve.
Pulmonary valve.
Thank you. Pulmonary trunk.
Pulmonary trunk.
Right and left pulmonary arteries. Yeah, that was real good. Okay. Right and left pulmonary arteries. And then to the lungs. You could say lungs, okay? Where are they all going back into?
Pulmonary veins.
pulmonary vein, and then to the left atrium. Okay, so let's do it again. Let's do it together, please. Right here, right ventricle,
Pulmonary valve.
through the,
Pulmonary valve.
to the
Pulmonary trunk.
right and left pulmonary arteries. Woohoo! Lungs, and then
Pulmonary veins.
pulmonary veins to the
Left atrium.
left atrium. Good. Good. Now, from the left atrium, we're up here. We're going to go through the bicuspid valve to the left ventricle, and then we're going to actually go up and over to the aorta, aortic valve, then the aorta. You have got to know this. You must know the flow, the pathway, the flow through the heart. Then when we get to the aorta, we're going to have aortic arch. That is incorrect. Right here, ascending aorta, aortic arch, descending aorta. Okay? All of that is on your sheet on the heart model. Now, a couple of more things that I want you to know. Anytime you see the word coronary, think heart proper. Coronary actually means crown, but the coronary arteries bring oxygen to the heart. Okay, blood is flowing through the heart and going to carry oxygen to everywhere else, but we've got to have oxygen delivered to our heart, right? So there are two coronary arteries that branch off of the aorta. That is an exam question. They branch off of the aorta, and you have the right, let me go to this one. Right here is the right coronary artery, and over here is the left coronary artery. Okay? Right and left coronary artery. Now, I actually have all four of these on your sheet, but we're actually only going to learn, you can mark out the marginal artery and you can mark out the circumflex artery. I'm interested in these two. So let's look at the word. It's kind of long. Anterior. So tell me, are you going to look for this artery in the front of your heart or the back of your heart? The front. Did I say anterior? Okay, anterior, the front. Okay, now look at this next word. Interventricular. Could that possibly mean between the two ventricles?
Yes.
So if you look at that word, it's telling you where to look. That is a very important, actually both of these are very important vessels. They supply blood to your ventricles. I think you figured out your ventricles are very important, okay? So, let me go. Nope. Okay. So, right here, this is the right coronary artery, left coronary artery. I'll show you again when we get downstairs. Right up here. So this is the right, that is the left coronary artery right here. when it branches kind of right here, that becomes the anterior interventricular artery. Okay. I'll show you downstairs that when we get there, in between the ventricles on the back of the heart, it will be posterior interventricular artery. So I'm going to share a very personal story with you that my experience. So, yeah, let's stay right here. So we recognize that that's a very important, I'm looking now at the anterior interventricular artery. It is oftentimes called the widow maker, okay? If that artery that supplies blood to both ventricles is blocked, then generally you have a massive heart attack and you die. So we talked about this already. What? The layman's term would be a heart attack. The medical term is a what is wrong with me? Myocardial infarction. This is an MI, and we routinely call it a heart attack. So when I was 18, there were 4 daughters in my family. My dad was a general dentist, and my mom had gone back to work at the hospital. She was a medical lab technician. And so Daddy had had a heart attack. I was in like maybe 8th grade. He had a mild heart attack, and then he recovered and everything. So 18, when I was 18, my 2 older sisters were already married. My sister next to me was at UAB in physical therapy school. And it was a Sunday. I'd come home. I went to college in Birmingham Southern, so I'd come home, it's just an hour away, come home for the weekend. And Mama was already at work, and Daddy and I were going to go to church. So I vividly, to this day now, at the time I'm 18, Daddy was 55. That's young, okay? That's young. So he came into the kitchen. I was doing something, probably drinking coffee. He came in the kitchen and he said, my family nickname is Bitsy, like the little spider, okay? So he said, Bitsy, will you tie my tie? And I'm like, okay, Daddy, I'll tie your tie. So really, he had tied it. I was just, straightening it up and everything. So I am standing there in the kitchen, finishing his tie. And died. I mean, fell to the floor. Absolutely no no ouch, nothing. I mean, immediately. Okay, now this is 1975. Y'all hadn't even been thought of. Probably your parents weren't even alive. People didn't know CPR. I mean, the physicians did, but not like today. People didn't know CPR or anything, and so I just knew, Daddy was laying in the floor. I did like the dumbest thing. I ran into the living room and got a little pillow and put it under his head. I'm like, and so I didn't know what was happening. Got on the phone, landline. It was probably Harvest Gold with a rotary dial, and I knew Mama's in the lab her number, and all I said was, "Mama, it's Daddy." And I guess the sound of my voice, I don't know. She knew, and so we lived in a small community, and Daddy was a dentist and like had hospital privileges, and so a lot of the physicians and families, we were friends and everything. So Mama came, and she brought Dr. Gordon with her, which I'd known him my whole life, okay? And I didn't tell you this, but right after Daddy fell to the floor, he immediately urinated. You know, just you lose all bowels, all urinary excretion and bowels as well. So they came and got Daddy, and so took him to the hospital, and we were waiting, getting all my sisters there. Barry was in Birmingham, and so we had to get everybody in the waiting room at the hospital. But I could see where we were, I could see in the back of the ER, Daddy was laying on, or I thought it was Daddy, laying on a gurney and just covered with a white sheet. So we were out in the waiting room. Mama was back there. So Mama came out there. She pointed at me. Now, all my other sisters were there, but she pointed at me. She said, "Betsy, come with me." I said, "No, Mama. No, Mama. Come with me." Okay. This woman went through the Depression, World War II, all that stuff. You don't tell other people no. They are strong women, okay? So I knew she was taking me back to Daddy. It's like, not me. But I went back there, and Dr. Gordon was there. And now keep in mind, he's watched me grow up. He's known me my whole life. And he looks at me and says, "Betsy, I want you to know that if I had been standing there tying your daddy's tie, I couldn't have saved him." And I said, but all I did was get a pillow, you know. And anyway, and Mama said there wasn't anything you could do. Now, at the time, I thought, why are they doing this? This is so mean, you know. I'm 18, okay? And now, afterwards, I'm thinking, what were they trying to avoid? Guilt. They're really, and they didn't use, if they did use the term widowmaker or anterior interventricular artery, I don't remember it, okay? But now I know it was the widowmaker. There wasn't anything I could do. So when somebody has just a massive heart attack and they absolutely just drop dead, then that's generally what it is. Now, you can have a heart attack because, like I said, 5 years earlier, my dad had a heart attack, but it was mild, and, you know, he just had to do different exercises, you know, different things. So, and then to really get me to understand, Mama said, because, you know, I'm acting 18, it's like, why me, Mama, why was I there? You know, poor me. She's just lost her husband, you know, but anyway, you know how you act. And I said, hey.
I was going to sit in your class.
Okay, good. Come. You'll sit in front. But you already heard this part. You're getting to the part where y'all gonna cry. Anyway, so no, so.
I wasn't here.
Oh, you weren't here. Oh, well, good. Hey, man. So, Mama said, she looked at me, she said, "Thank you." And I'm like, I didn't do anything. You know, I couldn't save him. And she said, "Thank you for being there. I know that it was hard on you," and it was. It was extremely traumatic. But she said, "Because you were there, I know that he didn't suffer." And he did not, y'all. He didn't cry out in pain. He didn't even say, ouch. I mean, it was so immediate that, you know, he was feeling no pain. And so she said, I know it was hard for you to be there, but instead of me being at work all day and walking in and finding him deceased, you were there and you could tell me. He didn't hurt. He didn't call out for me. He didn't lay there and suffer for hours. And you know, I'm thinking, once again, why me? But now that I'm an adult, it's like, I get it. I really do get it, because she said, you have given me an unbelievable gift. And that was peace of mind. That, you know, my daddy didn't hurt. And after watching my mother and my sister and my sister-in-law suffer through cancer, honey, pick me. Let me go out. I mean, that sounds terrible, but let me go with a heart attack, because it was instant, you know. And so I know it's personal, but I just share that with y'all because, you know, when you hear of somebody that just died suddenly, immediately like that, it's usually what it is it's a massive blockage to the anterior interventricular artery that supplies blood to both ventricles. Okay? So let's go. Oh, yay, we're ahead of time. We're doing great. Then I'm going to go ahead and do the cardiac cycle because it's so interesting. Okay, so here's the anterior interventricular artery, and then back here is the posterior, and we'll find those when we go downstairs to the lab. Nobody's in the lab, so we're going to go on down there in about 20 minutes. So I'm not going to break yet. What we'll do is we'll break as we go down to the lab, because what we'll do, we'll take everything with us, and then y'all can leave from downstairs from the lab, okay? So, cardiac cycle. Where's, there you go, thank you. All right, so this is 7. So we're actually going to do the cardiac cycle is actually the events of having a heartbeat, okay? So what I want you to do, and I think I've got it on there. When you see the word systole, that's how you pronounce it, systole, I want you to think contracting, okay? Just think contract. And when you see the word diastole, I want you to think relax. Okay, so we're talking about muscle. We're talking about the myocardium. Okay? So what I'm interested in, and what you're going to have to be able to do during the exam, is to visualize the heart. Visualize the valves. Because what I'm interested in knowing is what valves are open and what valves are closed. Okay? Here we go. So, during atrial systole, this is what I was talking about. When the atria are contracting, the ventricles are in diastole. Please, you must recognize that. When your upper chambers are contracting, then your ventricles are sitting there just waiting to collect the blood. Okay? So that means, this is what's important. AV valves are open and semilunar valves are closed. You must be able to think this. Think this. If I am moving blood from both atria, the right and left, and I'm moving it into the ventricles, then the AV valves have to be open. Okay? If the AV valves are open, the other two are closed. We're one-way streets, and we're telling the blood which way to go. Okay? Now, there's a question about blood flow. So, just put that most blood flows passively. Okay. Okay, now we're flipping. We're going to have ventricular systole, atrial diastole. Okay, so when both ventricles are doing that huge whoosh, okay, we don't want the blood going backwards. So what that means is the AV valves are closed and the semilunar are open. Now, what's going to happen is on your exam, it's going to ask you several different questions. It's not going to say AV valves. It's going to say during atrial systole, what valves are open? A, tricuspid valve. B, aortic valve. C, pulmonary valve. D, tricuspid valve, bicuspid valve. It's going to be D, okay? They're going to be, they work together. If AV valves are open, then that means both mitral and bicuspid and tricuspid are open. If they're open, the other two are closed. But you have got to be able to think that, because y'all know how the questions can kind of be a little tricky. So that's why until you learn for sure these words, I want you to think whenever you see systole, okay, I'm contracting. And whenever you see diastole, you're relaxing. Okay? Now, well, you don't even need that other part, because I mainly want you to know what the valves are open and closed. And it's going to be a big contraction because you've got to move up and out to get to the lungs or to get to the aorta. Okay? this makes sense to me. And the more you learn your structures and you think of the way it flows through, you'll be able to follow it. Okay? Great. Okay, so now let's look at heart sounds. Dum, 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 dum. I hate that our stethoscopes are still in pretty good shape, but our sphygmomanometers are about shot. Because I used to teach all my classes how to take blood pressure and everything and listen to everybody's heart. So I don't know, we may try. So the heartbeat through a stethoscope sounds, now listen to me, I can read, and I know that says lub dup, but mine doesn't do that. Mine does lub dub, okay? I do beats on both of them. Your heart may do a puh, mine doesn't. So what is making that noise? And that is an exam question. It is the heart valves closing. It's the action of the heart valves closing. Okay? So the first heart sound you hear, the lub, that is the AV valves closing. Which valves would those be? AV valves, tell me. Good. Okay? The dub, the second heart sound, is the semilunar valves closing. Which would those be? Right. Y'all have got to go home and learn all this, study all this, because I'm moving on. Okay? So please go home and study all of this. So you'll see that there is something called a murmur. A heart murmur is any abnormal heart sound, and it generally is caused by incomplete closure of the valves. Yes?
What causes abnormal heart rhythm?
Oh, we're getting there. We're getting there, so hold on. Wow, you got one? Anybody in here got a murmur?
My baby had one when she was born, but it
Yeah, and then it closed, okay. We'll get there, Lane. If you don't mind, I'll wait and answer it then. Okay, so if you ever go to a cardiologist, or really even any physician should, they're gonna put the stethoscope in 4 different places and ask you to breathe deeply. They're putting it where the valves are. They're trying to make sure that your valves are closing properly, okay? So they're gonna put one up in the aortic area, where the aortic valve is. They're gonna put one in pulmonary. Then they're gonna put one in the mitral area, and then in the tricuspid area, okay? Because they're trying to hear and make sure that your valves are closing properly. Isn't this stuff interesting? I just love it. Great, yay. So we talked about this, and we're gonna add these words. Cardiac muscle. Tell me. 201, cardiac muscle. Properties.
Oh, it's smooth muscle.
No.
It's striated.
I'm looking for. It is involuntary. That was one of the words. What about intercalated disc?
I didn't know it had intercalated disc.
You better have, would you? Shake your head yes so I'll feel that. Intercalated disc.
I don't think Gina
Emily, do you remember intercalated disc? Say yes even if you don't, please.
Yes.
Thank you, sweetheart. Okay, so that was one of the characteristics
Oh, wait, yes,
of.
it did have intercalated disc in the smooth muscle, right? Like, or is it only in the cardiac?
Only in the cardiac.
That's right.
Only in cardiac. Okay, so what happens is those intercalated discs, now I never could find any on the microscope because I'm so bad with the microscope, okay? But looky, their staking is right there in front of y'all. Could have cheated. No. Okay, so intercalated discs actually make the action potential, okay, action potential, nerve impulse. Because of the gap junction between these intercalated discs, the action potential is going to spread throughout the whole muscle fiber. That's the significance of the intercalated disc, is to spread that nerve impulse, okay? So this is the term you need to know and understand. The word is functional syncytium. Now, if you're talking about both, sometimes the word will be This makes it a noun. This is the same word, but it's a verb, okay? Syncytia. I think that I've changed it, and I believe it has this on the exam. But don't miss it just because it's not exactly the word. It may be a different tense of the word. So what happens is cardiac muscle forms a functional syncytium. You must recognize that word, and what it does, it makes the clump of cells and the clump of muscles act as a unit, okay? So you actually have an atrial syncytium, because both the right and left atria act together, and you have a ventricular syncytium, okay? And that's why it works so beautifully in unison. The atria work together, the ventricles work together. And the term we're going to use for that is functional syncytium. Okay? Great, that is an exam question. So we have been talking about, I think I can get through this, then we'll go downstairs. We've been talking about the blood flow. So if we're looking at maybe comparing it to a house, then we've been looking at the water, the plumbing, the commodes, okay, all of that. But what about, do you like lights in your house when it starts? So what about the electricity in our house that we're going to call a heart? So that's going to be called the cardiac conduction system. Cardiac conduction system is the specialized cardiac muscle actually initiates and distributes the impulses through the myocardium. Now, the SA node stands for sinoatrial node. And this is called the pacemaker of your heart. The SA node is the pacemaker. It initiates the stimulation, okay? The SA node, and then, now here's this word again, atrial syncytium. It's going to follow, let me go here. Okay, so the nerve impulse, the SA node is going to go there, and then it goes over here to the AV bundle. and it follows down this interventricular. So this is the right bundle branch, that is the left bundle branch. And then here where it turns on the lateral wall of the ventricle, we're gonna call it Purkinje fibers, okay? So let me go back here. What I really want you to know are the SA nodes, then the AV bundle, the right and left bundle branch, and then Purkinje fibers. And we'll look at this when we get to the lab, and I'll show you how I will ask you that. Now, you need to know that the SA node, write this down, it is an exam question. The SA node is located in the superior lateral wall of the right atrium. The SA node is, I'll show you, I hate to use numbers, especially when I can't see them, 32. So it is on your heart model located right there, okay? Superior lateral wall of the right atrium. So we're gonna stop, and Lane, can I wait on your heart rhythm question because Thursday we're gonna start on the electrocardiogram. Well, no, we are not, because I'm gonna hope to do a lot of lab. So we are to slide 29. So we're gonna all go down to lab, and you may leave from there. The hearts are put up. Can you stay a little bit, or you gotta go? You gotta go.